4 o'clock.
The briefing meeting of July 25th is called to order. First item on the agenda is School Health Advisory Committee Comprehensive Health Education with Ms. Roy. Welcome.
Is that working?
Not working.
All right. Have you signed in yet?
Red light is on. Am I working? All right. Let me get this pulled up here. I've got to put my glasses on because my eyes are aging almost as fast as my hair.
Mine too. It's a little too far from me too.
I'm glad everybody understands. Okay, so let me start by saying I'm going to breeze through many of these slides in the presentation. I know it's a very lengthy presentation, but a lot of the information has been included for you to be able to access information and data that I'm going to talk about today. You know, I know no one wants me to read things to you, nor do I want to read things to you. I know you all are capable of that. The first slide is about the recommendation from the SHAC Committee, School Health Advisory Committee. I just want to point out a couple of things. Comprehensive health education course requirement for students grades 6 through 12, and that health education should not be considered an elective course or an exploratory course. A comprehensive health education progression plan for elementary students. Instruction should be provided by certified health educators at the secondary level, 6 through 12, and I'm going to really emphasize that in a few slides later. Development of an action plan, including a timeline for the implementation, annual review of the policy, and inclusive input from certified comprehensive health education specialists. That's really, really important. So schools have a direct contact with more than 95% of the students nationwide, 6 hours a day for up to 13 years of their life. So the impact that can be made with comprehensive health education is really, really important. Healthy students are better learners. We know that. The research shows that. I've provided a link to the data through the CDC regarding healthy students are better learners here on the third slide. It might interest you to note that according to the Department of Health and Human Services, less than 12% of the American population are considered proficient in health literacy.
Less than what percent?
Less than 12%. Basically, a little more than a third are either considered basic or below basic. So I'm not a math teacher, but think about that. That means that at least half of our population doesn't even fall in below basic proficiency in health education. Research does show a strong connection between healthy behaviors and academic achievement. Later I'll show you some links that I provided for you to do to be able to see the research on that. And we do know that youth risk behaviors are consistently linked to poor grades and test scores and lower educational attainment. Again, links are all in here for you. The National Health Education Standards are a guide for basic health instruction. They have written expectations for what a student should know and what a student should be able to do by the end of grade 2, 5, 8, and 12. The NHES recommendation is for 40 hours of health instruction per year for elementary K through 2 and 80 hours of instruction for grades 3 through 12. That's equivalent to about 55 minutes daily for a semester for grades 6 through 12. This slide I just kind of put in more for your information because there's some really good information from the Society for Public Health Education regarding where we are, not just here in Florida, but as a nation in regards to health education. So I don't know if you're aware, but decades ago, back in 1973, over 40 years ago, apparently the state of Florida realized we had a need for health education. And they passed the Comprehensive Health Education Act of 1973. I've included the link of that for that. And I've also included the link for the current statutes which have been in place for over 30 years regarding required instruction for health education. Now, not to beat a dead horse, but for those of you that have heard me before, I have a tendency to do that, so I'll make this quick. I wanted to provide you a way to access all of the literature reviews and all of the research studies showing how healthy students are better learners. So you will find that on that particular slide, which I believe is slide 8. All right, so what does the research show? It shows us that effective school health programs are intense and begin prior to the onset of the risky behaviors. Adequate instructional time is necessary for students to learn essential health education knowledge and skills that are developmentally appropriate and build from year to year. And as I stated before, students K through 2, it's recommended 40 hours per year and 80 hours for grades 3 through 12. We also know that short-term, one-shot curriculum that's delivered for a few hours at one grade level is generally insufficient to support the adoption and maintenance of healthy behaviors. Link to that study is also there. And finally, the teachers, or the need for teachers who are certified in health education. And there are literally a boatload of slides that follow this particular slide. And I included them because I wanted you to be able to see how intense the training is for a certified health teacher and what all they need to know. So as you go through this, you know, over the past several months, I've been working with a team headed by Dr. Alyssa Barr, who's from the University of North Florida, and Sina Zipperer, who is with the Department of Education. We've been developing a free online professional development test prep course for health certification exam. According to the testing company, the health certification exam has the lowest passing success rate of any of the subject area exams. So again, I'm not going to read these. You have these. You can see all the lovely things that health teachers need to be able to know coming in so that they can do their jobs effectively. And I told you I was going to skip through lots of this stuff. This slide illustrates the original draft policy that was recommended to the board back in 2000, actually it was 2016. At that time we had a Lee County School District Health Education Task Force, and that is who came up with this original policy. SHAC has been very concerned that some of the things in this policy did not make it to the actual board. Those included bullet number 4, which says that although some health concepts can be addressed in physical education, particularly at the elementary level, health education is a separate subject. That was removed from that draft in 2017. Additionally, bullet 9, that this policy would be reviewed annually, was also removed. The reason we stress the importance of that annual review is we are just starting. You know, getting that policy passed in 2017 was a monumental achievement for this district, but we have so far to go. So an annual review to make sure that we keep the ball rolling on this was critically important. The next slide simply is the draft that was ultimately adopted in July of 2017. And again, if you refer back, you can see that those items that had been left out. There are a few points that are key to health education in the Every Student Succeeds Act. School health and physical education are identified as part of a student's well-rounded education. That term replaces core academic subjects from previous versions of the Elementary and Secondary Education Act, like No Child Left Behind. Subjects that are part of a well-rounded education are eligible for federal education funding. And this is crucial because I will tell you, the 99.9% of the time, people will tell me how important it is to provide good health education to students. And the number one pushback, unfunded mandate. I cannot tell you how many times I've had that hand in my face telling me unfunded mandate. We know it's important, but they're not paying for it, so we're not going to do it. Additionally, school districts will be able to access funding for health and physical education from Title I, Title II, and Title IV through the State Department of Education. I've included letters of support from the following. And again, I'm not going to leave these up here long enough to read them. You have them in your packets. The Florida Department of Health, Lee Health, Lee County Coalition for a Drug-Free Southwest Florida, Abuse Counseling and Treatment, community member from Cape Coral, a letter from the other co-chair of SHAC, who is a local pediatrician, Dr. Stanley Wiggins, There was another, by the way, there was another letter that we received too late to get into the packet. It is compelling, this letter. It was so well written and made me feel very inadequate in my expression of the need for health education. So I will make sure that that is forwarded to all of you. This is the recommendation, just because we haven't had this task force since 2016. This was the original recommendation by our health education task force. And this was also a letter that we received. I was asked back then to present to the district advisory committee. It was interesting. I was asked to, first I had to present to you guys, and then you guys said go to the district advisory committee. So I did that. And I came back to you guys, and then you said go to the curriculum committee. And I went back, and so people are getting real tired of me, I think. So just trying to avoid that, but ultimately those types of things happen. I have 3 quick things that I want to kind of update you on what's been going on that is not included in your packet, mainly because some of it is so recent. And some of it, let me just tell you what I'm talking about. Okay, so over the last several months, I participated in the Florida Surgeon General School Health Ad Hoc Advisory Committee that was created by Surgeon General Dr. Celeste Phillip, on September 17, 2018. We were tasked with making recommendations to the Surgeon General by June 30th of this year on best practices and initiatives that focus on increasing the quality of physical, mental, and behavioral health care and improved health outcomes in the public school setting. Major increases in school health education was listed as a top 3 priority by this committee, and a white paper was just recently submitted to that effect, which did include the emphasis for funding. The second thing, yesterday I received an email. This was sent out to all district health coordinators, since we do not have one in our district. Being the subject area specialist, I received the email. And it was from the Florida Department of Education regarding information on an initiative by Florida Governor Ron DeSantis, First Lady Jill DeSantis, and the legislature. Rule 6A-1.094121, Mental and Emotional Health Education, establishes minimum hours of required instructions related to mental and emotional health education for grades 6 through 12. I was told by the DOE that this was expected to pass, and when it goes before the state board on July 17th. Additionally, I was told to expect something very similar regarding substance abuse prevention education. Jill DeSantis seems very interested in that subject. And of course, these are already included in what is taught through comprehensive health education and through our state statutes. Finally, I was encouraged when the school district asked me to take the lead in the development of scope and sequence and curriculum maps for health K through 12 for the Lee County School District. These will provide a progression of comprehensive health education beginning in kindergarten and will build on knowledge and skills from year to year. Several of these have been completed, and you will be happy to know that the requirements of the mental and emotional health rule going before the State Board of Education July 17th and the potential substance abuse prevention education requirements are included in those curriculum maps. I would like to thank you for providing me the opportunity once again to advocate for comprehensive health education, and I'm more than happy to answer any of your questions at this time.
Well,
Ms. Fisher?
yes, okay, I'm going to start by thanking Leisha for her unending work. She's considered an expert not only in this district, but at the state level, as evidenced by the number of task force and committees that she's asked to participate in. I have a question about, so the state requirements for, and the new initiatives regarding nutrition, mental health, suicide prevention, which was another big one I read, and the substance abuse prevention. These are actually met with our standing comprehensive health education.
Yes, the
Curriculum.
the way the statutes are written, all of those topics are covered. You will see that in not only the statute, but also through CPOMs of all the course requirements. All those items are listed.
And I had a conversation with Lori Brooks this morning because she's been getting, through her mental health committee and the asks for the need for the substance abuse and the suicide prevention, along with mental and emotional health. And there is some funding, and there's also some mandated training for staff, which I understand is not going to be funded by the state, but be incorporated by districts. So I think that what I want to say is that Lori said, that the DOE is very clear about this, and with the governor and his wife checking in on this and backing it, I think that we need to look at this and say, we can't afford not to do this, because we're in this position based on things that have happened around the state, because we have digressed from a well-rounded education and focused a lot on accountability, and I believe that accountability is extremely important and necessary, but not to the exclusion of having kids who are healthy and ready to learn. I mean, if we look around, we know that we have some serious situations with obesity, with diabetes, with smoking, and those kinds of choice-related diseases now. And I think if we start young, I mean, we're doing a wellness program for our staff who are adults. If we start with the students when they are young and provide them with the skills and information that they need to make healthier choices about nutrition and physical activity, I think that in time, we'll see a big return on the investment. And I know that there is funding available and through the Title IV, Title I, and that there also, when I attended the Healthy Lee Steering Committee and the Behavioral Health Task Force, they are finding support in the community for funding for this kind of thing and are interested in working with us on that. So I want to thank you once again for all that you've done, because the work has been phenomenal, and this is a great presentation. Thank you.
Mary.
Other board member comments or questions? Please, Ms. Vaughn.
Yeah, I would also like to thank Leisha. I'm actually, even though Mary's the real expert here, but I have been the liaison to the SHAC committee, and I think I first heard you speak on this topic well before I ever ran for school board, probably back in 2014 or 15, and I've always been so impressed in your depth of knowledge. And I agree with Ms. Fisher that we can't afford to not do this, and especially with the emphasis on mental health. And I know we've had, I'm also on the curriculum, also liaison to the curriculum committee and Head Start. And it's amazing how, and this is that horizontal composite thing, it's amazing how these committees, we all had similar touchstones, because what I saw was that in the Head Start program, they actually do some of the things that, age-appropriate things for these kids, which are things as simple as washing your hands and brushing your teeth. But that's important, because we have kids that don't have access to the basic needs of humans for cleanliness and that sort of thing. We also touched on this last week when we were going over the different curriculum at different schools. And I know what we said about schools, the middle schools. What kid is going to choose health when they can choose fly fishing or the history of rock and roll? I mean, really. But that's all well and good if they have time to fit that into their schedule. But aren't we here for the benefit of our children, and aren't we making decisions to have our children healthy? It's like the mom who says, no, you can't have cookies for lunch. You have to eat some fruit and protein. I mean, we need to be making some of these choices, and it may not be popular for me to say that I think in the middle schools that offer these fun classes. Keep them on there for the kids that can have time, but let's put this back in there. And again, like Ms. Fisher said, we can't afford not to do this given the current climate. So thank you again.
Thank you.
Ms. Morgan?
So, what can I say, Alicia? I know you're right. I've listened to you for 6 years, 7 years. I appreciate your work. You've made the case. There's no question. So my questions are, we have the curriculum now.
Correct.
Okay. Do we have certified teachers?
I don't know at this point if we have enough certified teachers, depending on what we decide to implement. And one of the reasons we made peer counseling available as a year-long course in 6th grade was because it doubled the length of the class time, which would allow a non-certified health person to be able to have more time to cover the material because they don't have that background. I would certainly hope that at minimum we could get one certified health teacher at each school who then of course could help that non-certified person understand. I know when we were working on creating this professional development to pass the health certification exam because it's so difficult, we're actually putting forth a recommendation that any teacher that really wants to be certified in health education teach out of area for 1 year. Get your feet wet and then come take that certification exam. I know that there are several schools in the county that do have 2 certified health teachers. I know there are schools in the county who are cutting health education. So, but to answer your question, I know that Dr. Quisenberry and Ms. Houchin have a list of how many people we have in the district that are certified. But I can't answer that question to the exact number for you right now, but I can certainly provide you with that information.
Okay. Dr. Atkins, are we getting this Title I, Title II, and Title IV money that she referred to, and what are we using it for if we're not using it for this?
Yeah, I'll ask Dr. Quisenberry to help me with that response.
Okay.
And while she's making her way up, our curriculum team is working with Leisha Roy, and I would, as you're working on the curriculum maps and the academic plans, and I look forward to, really a recommendation in terms of what we need to do as a district moving forward to be in compliance with the state requirements.
I'm laughing that I'm director of instruction and it says, "Do not push Mike." It's like 4 times. So for Title IV does cover health and physical education. So one of the things that we did this year was we allocated, I believe it was $1,000 to each school PE program, and then they were able to use that funding for their specific needs because every school has different needs whenever it comes to the equipment or the different things that they need for their physical education program. So that was one of the things that our Title IV money went.
I'm sorry, how much?
I believe it was $1,000 per school.
Well, good.
Yeah.
That goes far.
We're also using that funding, the Title IV funding, to support a record of hours for the curriculum map writing and rewriting that we're doing. So we're using the funding that way. And then
That is a big chunk of the money. So the work that Leisha was referring to, the teachers have a record of hours and they're paid their hourly rate for all of the, the work that they do on their own time for this. And so I believe it was over $300,000 that we were allocating for that.
And then we also, out of Title II, then our PD money, then because often the health teachers and/or PE teachers are singletons in their school, we're going to do some PD like at site-based, like at each zone, and we're going to work with our specialists to support that as well, and so that they may get some PD at least each semester, but quite possibly quarterly.
Okay. I know that some of the state requirements can be done virtually. Has the state considered doing virtual health education? And I realize that you don't have that personal interaction I know what you're going to say, but even if it weren't every year, but components periodically, just with, is there anything in the works that would allow us to do some of this virtually?
I can tell you, based on this Surgeon General's ad hoc committee, the recommendation in the white paper was absolutely not.
Okay.
That it was critically important to develop that rapport, to develop that level of trust. I'm not.
No, it makes sense. I
It-
just wanted
But it, that was inclusive in that white paper. I do know that across the state, there are districts that are pushing that to satisfy that online component. But again, that was a big stressor in that white paper, that not happen.
No, and it makes sense, but I just wanted to know if it had been rolled out. So essentially, and has Lee Health been involved at all in this? And have they made any contributions with respect to professional development, certification, that kind of thing?
They have offered some training. I know that, I don't know if you two know, if the mental health first aid training that Lori Brooks's groups have gone through, if that was, I think that was assisted by Lee Health. Again, don't quote me, but I'm quite sure that they were involved with that. Back in 2012, I actually had approached Lee Health and was this close to having a elementary curriculum purchased by them for the district until they found out that this was a mandate, and we just were not doing it.
Okay. And so I guess what you're briefing us, because you're asking us then to direct the superintendent to include a unit of instruction by grade, by level. What is the recommendation here that we're?
The plan is for a progression of health education in elementary schools, and we have discussed, because it's very difficult with the scheduling changes, differences at that level, to incorporate that into our physical education courses, K through 5. Grades 6 through 12, again, 80 hours is the national recommendation. That is what the white paper that was sent recommended, because you cannot have a progression from year to year. Some of my colleagues that were helping write the HOPE plans and the PE variation plans at high school said, I can't go this in depth. The kids come to me and they don't have anything. Of course, that's changed a little over the last 2 years because of that, the only requirement that we actually have at the 6th grade level. But for them to get the advanced information, for them to become that have that proficiency in health literacy, we've got to build every year. So yes, that I believe that is what we're saying.
Okay, that's it for me. Thank you. Thank you very
Ms.
much.
Gittens, we are running short on time here, by the way.
Sorry.
So do I go ahead or not? Okay, quick question. Is there a list of schools that have higher needs for the mental health issues? I know you said some of them have removed that position, but have we looked at as a district where are the hot spots that we really need? And is that based on services, or how is that? And I believe that would be you guys. Do you understand what I'm?
Yes, Lori Brooks would be better equipped to speak to the mental health side, but as far as wraparound services for elementary, in elementary, we teach health through our nurses, and so, and through physical education as well, because the health standards are a part of PE. And so in our tier, not all, but in many of our tier 3 schools, there are full-time nurses as well as full-time social workers, and then full-time behavior specialists. So through that wraparound services of those, of those experts, then they're able to then help the higher need schools with their populations.
Is there a list of the higher
Yes.
need schools, though?
Yes.
And I can talk with you off
Yes, and I can
about
get that for you.
Okay,
Yep.
thank you.
Were there other hands up down here?
I just said really quick.
Making sure everybody gets a chance to speak once. Go ahead.
I just had a question of Dr. Atkins or maybe the ladies in academic services. It's my understanding we do not have a coordinator for health right now, health education, right? That's correct. It's just Leisha's like the highest level, and she's a specialist housed at a school. Did we ever have that position? Do we not have a coordinator for PE?
We do not. So we have, you know,
Okay.
as supplemental positions, we have content area specialists that are school-based that receive a supplement for working collaboratively with us. So the work that she's speaking to, Morgan Wright is PE, and Leisha graciously covers health, and then they receive a supplemental contract for that, and then coordinate with our department for that work.
To answer the other part of your question, in the past, we have had health coordinators. I remember when I was a science teacher assigned to teach health. I was also, believe it or not, and Leisha, don't cringe, but I was the health department chairperson or director at my school. We reported to, I think it was Betty Harmon.
Betty Harmon, yeah.
Was the coordinator for the district at that time. But at that time, the district office had a pretty large curriculum department, and I mean, probably larger than we even have today. That was back in the 80s. And they literally had, PE coordinator, health coordinator, science coordinator, social studies at different levels. So much larger than we have today.
And just for the coordinators that we do have in our department, we do not have a science coordinator either. So it's not that, health and PE, right, as Dr. Atkins said. And then for social studies and for STEM science, it's a K-12.
So you're working on this. I guess nothing will happen in the 1920 curriculum because we're there. So I guess my ask would be that we schedule a briefing sometime after the first of the year or a workshop so that you can bring us up to date on where we stand with all of this in anticipation of the 2021 school year?
Yes, I'd be happy to do that. And in addition to that, I think along with the updates in terms of how we are on the curriculum maps, I think we still also can talk about how we are delivering it through the academic plans for this particular school year, but then moving forward, how that can change with the new budget cycle.
Okay, I have a quick question for you. You said that the frequent pushback is funding. For me, the frequent pushback with my constituents is sex education and what we're doing to inform parents when that particular part of the curriculum is upcoming and giving parents the opportunity to opt their children out.
I will assure you that, first of all, state statute says that a parent can opt their child out of any teaching of human reproduction and disease transmission, including STDs, HIV, and AIDS. Although we are a comprehensive health education district based on our policy, we do emphasize the importance of abstinence education, but, real world. Students need to, that are not going to heed that advice, need to be aware of birth control, disease prevention, that sort of thing. But again, parents have that option to opt out of either of those two subject areas without opting out of the health course itself because of all the other areas of instruction. But for those in particular, they absolutely can opt out. And I will tell you, in 26 years of teaching, I've had 3 parents opt their children out of sex education in my class.
So what are we doing from a district perspective to make sure, Dr. Atkins, that parents are receiving notification when these items are about to be taught in class? Because even if I don't want to opt my children out, it is an opportunity for me to talk about it with them when they get home.
And Alicia can answer this better than I, but my understanding is that they typically receive notice from the instructor to do that prior to that instruction taking place in the classroom with the opportunity to opt out.
Many of the instructors that I know, ask me about that, and I have encouraged them, strenuously encouraged them, to make sure that they do that. My students, for example, it's not I want a parent signature on that letter so that I can say, look, you read this, it's here, clearly stated that you could opt that out. Back when the original policy was adopted in 2017, it was in my understanding that a district-wide letter was going to be made, I doggedly stayed, you know how I am. I stayed after, and I stayed after, and that did not get accomplished. That was above my area.
Yeah, I was instructed last year, and there is an opt-out letter, and we actually met with the principals to make the determination whether they were going to do an opt-in letter or an opt-out letter, and they all agreed to do an opt-out letter, and so it was pushed out to all of the principals to push out to the teachers, and then it was also on their in their Google, the principal's Google administration, Google Classroom. It was pushed out to the assistant principals for curriculum. So for secondary, we did have a letter. So we've had it for a couple of years now.
Do we have confidence that it's being sent to parents?
I would say that it is being sent to parents because the principals were very concerned that they had it. So I can't imagine that they were sitting on it because it was at a request from them, not just Leisha, that we made sure that we had a consistent form for the parents to have.
Okay, and then my final question is, a parent who wants to be involved in curriculum or content approved for these courses with specific regard to sex education, what would be the best outlet or best opportunity for them to get involved?
So textbook adoption. So, when we have textbook adoption, it's open to community, and now we are including students in that as well to participate, and those notices go out via our district website for parents to be able to do
But
that.
today was not curriculum, today was more comprehensive policy and implementation, right? Okay.
Yes.
All right, excellent, thank you. And Ms. Roy, everybody has already said, when you're at the table and Ms. Fisher is at the table, I feel like we have as much expertise as we can possibly have in this area, so.
Thank you, I appreciate that very much.
for your dedication to this. All right, I think that covers that agenda item. Next, we will be dealing comprehensively with safety and security policies with Mr. Parfit. And rather than go through each policy individually, I think Mr. Parfit's going to try to deal with them sort of as a whole.
Good afternoon.
Good afternoon.
I'm here to present for your consideration and subsequent approval 12 policies. 3 of these policies are updated, and 1 is a new policy, and these are updated per statutory changes. And while we were doing that, there were the other policies just to receive some minor procedural changes, clarifying titles, departments, and updating technological changes. The 1 new policy for your consideration is the threat assessment team policy, and you have those all in your information.
So do we have colleagues had an opportunity to go through and look at these in a detailed way? Do you have any questions on any specifics here? Any concerns, any discussion?
I'm going through my notes.
I had a question, if I may. District-wide sign-in procedures, policy 2.01. Is there a way for us to move to the use of technology in this sign-in procedures without using those books?
That's probably something that we have looked at. Part of what we do with the district sign-in, we use the keep and track system for checking for sexual predators and offenders. But as we update our access control systems, I'm sure that's something that we can do with a card. We just don't have, everybody in the district doesn't have that ability right now to, for example, to swipe a card.
Okay.
Go ahead. My question is on the zero tolerance piece, 4.08. First off, how this is being affected or has been affected by the vaping issues that we have seen increase. Is that the rationale behind some of these changes?
Well, actually, the changes come more from statutory changes, but that has, of course, been a concern of ours. And what Ms. Giddens is referring to is the vaping of THC, because it's an extract, is a felony. The working with law enforcement, they have alternatives to that, and that's our goal, is to try to divert those students away from arrests. But we did see an uptick in those this year.
So it's not a statutory policy now that you have to have it involved, included in this particular statute, right?
That's correct.
But have we added anything to address that?
Well, probably the biggest concern that we have in those kind of cases is that our policy says that we consult law enforcement on felony offenses, and since that's a felony, then it becomes out of our hands in many cases.
Ms. Fisher, did you have a question?
Yeah, my question is about 2.16, the threat assessment team. So those teams were formed this past school year.
Yes.
And so how is that going? How is that implementation going? Because I know there's some required documentation regarding the meetings and any assessments that they do with students. And I'm just wondering how that district-wide, kind of like with the health education policy, how's the implementation actually going? And is that something that is a district-wide requirement?
Yes. Again, this follows right along with statute, and also we added our own district threat assessment team. But it went very well. We've trained upwards to 500 team members this year, and we'll continue to do that in the coming year. We actually had an in-service training. We had about 140 of our threat assessment team members come at the end of the school year as well. The procedures have been in place for that since last summer. We drafted procedures for that team. We currently are working with some of the technology folks to develop a reporting system, a records management system in Castle, and they're working on that. We should have that up and running by the start of the school year.
Okay, thank you.
Ms. Giovanelli?
She was,
No,
for me, okay, you don't mind. Okay, so I have a couple questions. Policy 214, the monitoring, are all the schools monitoring the systems, and is that all being monitored and everything? That's one of the questions I have.
All of our schools have certain levels of monitoring, and for example, the closed circuit TV is an ongoing process. Technology Services has a plan in place on a refresh. So we initially installed the video entrances for the front entries of all the schools, and now we're going in and refreshing outdated systems, and along those, at the same time, we're adding additional closed-circuit TV. But all of our schools do have certain levels of monitoring, and it will improve as we go through this cycle.
So one of the things that's happening is we are moving from some of the older schools have analog systems, and the resolution of the analog systems is not nearly as detailed as what you get with the digital system. So as we're going in and doing the updates, we're updating those schools with cameras that have a much higher resolution. This has been a really quick payoff for us. It's helped school staff be able to actually identify students or other personnel much more accurately than we've been able to do in the past because of the improvements in resolution. And with the new referendum dollars, this has allowed us to kick in and accelerate this camera refresh substantially than what we were going to be able to do without it.
That's really important. So then, okay, I have another one then. 2.31, the vandalism and malicious mischief. So how often are 1 and 3 adhered to, like, regarding the damages? Like, who enforces that? And what authority do we have as a district in the policy that, what happens when they don't pay for the damages? So, like, what happens?
The Student Code of Conduct does cover that to some extent, but if it's a criminal case, if there's a prosecution, then of course that rests with a court to order restitution. If it's an internal matter with the school, we would have probably a lot more difficulty in trying to recoup restitution from families that are unwilling to pay. The school could go after them civilly, and I haven't been here long enough and don't know that they've done that, but I would imagine in substantial cases that would be an alternative that we would use.
I do know, like in some cases with our restorative justice, we actually do offer that as a part, where they can, if they do some type of damage, they break something, rather than necessarily serving a out-of-school suspension, restitution of the cost of damages and so forth can be a part of that. That is one of the options that they have. We also have other things that can be withheld, like participation in extracurricular activities and things like that. Typically, they won't allow if a student has a pending fee or damage that they have to pay. So I can have Dr. Bohatch maybe provide you a little bit better explanation of that, because I know he's right. These are type of things that are right up his alley, so I'll be happy to do that.
Okay, that sounds great. For the district, that's the cost to the district, so I'm just curious, how often that even really exists, but I was just curious.
One of the things, just somewhat right along those lines, is this issue has come up with Chromebooks and
Right.
damages of Chromebooks, and our high school principals and middle school principals have really asked for us to continue with having teeth in that policy. So we are continuing to do that. There had been somebody had kind of forwarded the idea that we don't need to pursue this as actively, but they asked us to continue to do that, and we agreed with them. So we continue to do that if they damage their Chromebook.
I have one more. I'm done, I think. Policy 2.32, lost and stolen property. I don't see a time certain, like when the principals need to be reporting this, and like when property's lost or stolen, or they can't locate it. So I'm curious, like, what's a time frame in that? I guess it would determine when they noticed it missing, but I think there should be something in there about time, and I don't know, I don't write policy, but,
Well, it is a good point. With our unable to locate, that was where this issue has come to light for me. It's an item that I've asked staff to make some improvements in terms of our process and procedures. We do have a requirement if we think something has been stolen, that is something that we need to make sure that we bring to the immediate attention of law enforcement. So that's something that has changed in our process. The other thing that we're doing is we're wanting notice to be provided to the school district and initiate the process for location quicker, and not do it used to be 2 years. They would, if inventory came out and they said, we can't find this laptop, then the school could try to locate that laptop. If they didn't locate the laptop, usually there wasn't anything that happened until the next year. And then next year, if that laptop was still fell into that unable to locate category, then it would be put on a board agenda as unable to locate after that second year. I felt that wasn't fast enough. I think we needed to jump on that quicker, and so staff has instituted some new policies so that we do that, because oftentimes you know, if you really make an earnest effort to try to locate something, then you can find it. But if you have time go by, there's staffing changes, like principals change, staff, like we're dealing with one right now, that we've had some staffing changes, principal change, we had a warehouse staff changed, and so when you're trying to track something down, the people who might have been touching this item are gone from the district. So I can, again, with this one, provide you some additional details. You know, we did have Mark Santiago available at the workshop. That would have been a good opportunity, but we can still follow up with that and have you have a little bit more information relative to our process and procedures when it's when we come across unable to locate.
So, but this policy has nothing in here about the time, so where?
Upon, that's as soon, upon means now.
Well, that's upon,
So if I know that this is gone now, I'm going to report it upon knowing that that's gone,
yeah, but
without putting an exact
I don't think
date.
upon is, yeah, I think it's too vague. I think it's discretion, that's discretionary.
If I may, upon discovering to me means immediately as well.
Okay.
Upon discovering, there are very specific steps that have to be taken upon discovery. That means as soon as you find out it's gone, those are the steps you have to take. So a time certain, we don't know when it's going to be discovered, so it's kind of hard to time certain.
Sometimes it's not discovered until the inventory cycle, so, yeah.
Our expectation, and I can again have staff follow up, but our expectation, my expectation is if you discover something has been stolen, upon discovering that, you need to notify law enforcement. You know, we've had in the past, you know, the law enforcement, if we don't do timely, you know, we get chastised by law enforcement, you need to notify us. So, you know, that, as I read that, that is our expectation. You know, if you, as soon as you notice that something's gone, that's what you should do.
Ms. Jordan?
Yeah.
you're next. Is it on the same subject?
Yes, I was going to talk about the same thing, actually.
Okay, Ms. Gittens.
The question, it was on the 2.31, and my question was kind of what you were just talking about. When is law enforcement involved? And is there like a dollar limit or something that, I mean, we don't call them every time there's a Chromebook missing.
No. The statute allows us, and the policy allows us to handle petty thefts, and petty thefts, I think it specifies in one of the policies, are under $300. So it does outline that a little bit. The vandalism, the same way.
Okay, and my second point was on 2.14 with the district. Are there periodic drills or awareness of emergency procedures in the district office? Not saying we have to have a fire drill, but just, is there an, update or periodically an awareness time of this is what we do in this type of an emergency?
Yes, yes.
And it's.
And we're updating some of the emergency response plans right now as well.
And a scheduled time to inform everybody about that?
That we do those for the schools, yes.
No, I'm talking about district.
Oh, for this building? There's no, we don't have a time that we schedule them, but they're advised as well of any changes in our procedures.
Okay, and the last thing is that, so in general, the statutes that you're showing are general laws and rules, and the specifics would be in our code of conduct. Is that
That's
to
correct,
say?
yes.
Okay, thank you.
Ms. Jordan?
I had the question regarding the one that Ms. Giovanelli spoke about, and then also 2.31, as far as vandalism and if a child or student has destroyed something, I thought a lot of times it's included in like their fees and fines towards graduation, and they would not graduate or walk until those fines are paid?
I believe that's covered under the Code of Conduct.
Right?
Yes.
That's what I thought. Thank you.
Do we have any other questions or concerns? I think our next step here is another briefing, right, before we adopt these changes?
Is this the pre?
This is the pre. Okay, thank you very much.
Thank you.
Next item on the agenda is public comment. Are there any members of the public that would like to address the board?
I'll go second. Anyone?
Thought we had one.
Ready for me?
There's one over here.
Mr. Scott, please fill
Gentleman
out a
over
blue
here.
card and take your turn. Sir? Are there any blue cards? Attorney Gabriel?
Thank you. School Board policy provides the opportunity at this point in the meeting for members of the public to address the board concerning any matter on this briefing meeting's agenda. The subject of comment is limited to those items on the agenda. The time permitted is 3 minutes per speaker. No cards were submitted or prepared. I believe there's 2 people, 2 parties, so there'd be 3 minutes provided.
I've been to the school board meeting in the evening, and I brought up a subject about Abraxas.
I'm sorry, sir, could you please identify yourself?
Yeah, my name's Ray Troy, T-R-O-Y. And I brought up the subject of Abraxas, and I gave you the website to the superintendent of school and to all the board members, and I believe only 1, maybe 2, have gone to that site to even look at it. That is a system was set up in Pennsylvania because they were not given equal education to special kids. And they took the money off all the local school districts from the federal and the state government and gave it to the IU units. I was on one of the first units, was IU 6 in Clarion, Pennsylvania. And we started the school, the first Abraxas school was started in Marionville, Pennsylvania. And the first graduation class had 11 kids in it. All 11 went to college. How that come about is we hired these teachers, the special ed teachers, and they helped those students to learn. They were kicked out of school, and they went to court because they had created a felony. And they gave them a choice. The judge in Pittsburgh, you can call that same place in juvenile court in Pittsburgh, gave them a choice. You want to go to the Abraxas school or you want to go to prison? And they went to the Abraxas school. And every one of them graduated. They were there for 2 or 3 years under strict supervision. No fences, no barbed wire fences like they have here in Florida. They were on their own. If they left that campus, we had one person we had to send back, and he went to prison because he went a block away from the school and got an ice cream cone and come back to school. But he left and never notified anybody, so he went to prison. And that's what everybody was working to keep everybody to learn. I see, down here, once they commit a crime, they go over here to the sheriff. And the worst thing I ever heard from the school board was one of the school board members, previous, told me that they had a fast-track system of taking care of everybody who drops out of school. It's called the Sheriff's Department.
Sir, your time is almost up. Please conclude.
And that's where they learn how to become a criminal. I'd urge you to call and find out all you can find about Abraxas. They have many people in their school system now. Over 7,000 students in 5 states is using the Abraxas system. And the people were sent there from the courts. Thank you.
Mr. Scott?
Sir, if you would,
My name is Randy Scott.
Susan and Mary.
proceed.
Yep, my name is Randy Scott. I just wanted to acknowledge it was kind of you to allow him to speak off the agenda. I think that's pretty awesome. The agenda today had code of policies, and I watched as I was driving here, And it struck me that half the policies we don't follow anyway. So it makes me wonder what kind of drama we're doing here if the policies really don't matter, because they really don't. We have policy 5.31, which talks about how investigations are supposed to go. We don't follow that. I listened to Mr. Parfait talk about the policy regarding unable to locate items. I heard Dr. Atkins talk about that. We don't follow that. Florida administration rules tell us that we're supposed to have an inventory every year on items over $1,000 purchase price. We don't do that. If we did, we wouldn't have that $15,000 trailer, of which our Department of Professional Equity deleted the video showing it pull off the lot. They deleted it 20 days after the police report was made. That's suspicious activity, not only not following policy, but why would we remove a video of a crime? I contacted the Fort Myers Police Department to get an unredacted version of there because there's a suspect identified. They told me that it's still under investigation for the past 2 years. I just suggest that if you're going to have policies, you should follow them. If we're going to be an organization instructing children on their civic responsibilities, then we need to lead by example and follow those rules. The problem I'm hearing in this district by teachers and students is the hypocrisy between what you say you want and what you do. The fight you have against state legislators is another example. You thumb your nose at what they tell you you're supposed to do, from the policy that requires you to have bus stops 50 feet from a corner or 200 feet from an uncontrolled stop. That led to 2 deaths, and it falls on deaf ears. 2 children died because you didn't follow the policy.
So your time is
Scott,
on.
please, thank you. Dr. Atkins, do you want to respond to Mr. Troy, or should I forward the email that was sent to us by your staff on May 21st in response? Oh, he's not here anymore.
He's right there.
Oh. In response to the question, I'm looking at it now, it indicates that referrals to a place like Abraxas should be made through our mental health providers, and that this issue was raised with our mental health partners during their last monthly meeting. I just wanted you to have that information. That's beyond the realm of what we would do as an education institution, but it has been brought to the attention of our mental health partners.
Right, I did go when he came here last time and went to the website and then referred it to our Academic Services Division, which is what led to that response.
Excellent, thank you. Okay, next on the agenda is board member comments. Ms. Fisher?
Yes, thank you. I'm going to give a brief update on my strategic plan involvement. I attended the Healthy League Coalition Steering Committee and the Behavioral Health Task Force, and worked with community partners in planning to move forward with the community partnerships that we have memorandums of understanding with through our counseling and student services department. Also working with the Lee County Coalition for a Drug-Free Southwest Florida Board of Directors and participating in substance abuse prevention activities with youth such as Drug House Odyssey, SAD, Students Against Destructive Decisions clubs, and incorporating community support, financial community support to provide the opportunity to enhance these programs. We continue to work with School Health Advisory Committee to advocate for the implementation of the Comprehensive Health Education District Policy. And we continue to network with community agency partners such as Salis Care, Elite DNA, Hanley Center, et cetera. I want to once again thank Leisha for her work over the years on the Comprehensive Health Policy, and I'm hoping that as we see more time certain in the requirements from the state, that we will step forward and be one of the first districts to fully implement. Insurance Task Force is working on reducing premium costs. We're having additional meetings, working with Lee Health and other companies who are proposing cost-saving ideas. They are minimizing the number of plans to 3, maximizing the savings, and looking at coverage for in-network by using an advanced formulary for drug charges, and working with the new plan to understand that anything that is an emergency will be charged at the in-network rate, even if you're out of the area. And the last thing is that the wellness programs are being tailored to address the most costly diseases, and that is tobacco cessation, the walking challenge for obesity, and pain reduction nutrition. And I attended the PACE Center Advisory Board, loved that dress fundraiser event, which was the Funky Fashion Show at the Cape Coral Yacht Club, and that was, showed a lot of creativity and a lot of fun, and raised like $24,000. I want to wish best wishes to our retirees. I saw Dr. McCullers here before, and thank the staff for all the work they've done over the summer, and thank my colleagues. It's an honor to serve with you. And I'm going to end with a quote: "Change is inevitable, growth is optional."
Thank you. Ms. Giovanelli?
I have none. Says everybody have a safe summer. We're going to have a little time, so enjoy your vacation and
Ms.
a little
Gittens?
time off.
First off, I wanted to thank everyone on the team and staff that have been involved with the strategic plan project. Yesterday, we completed the final meeting. Each of us met with our strategic plan teams, and staff has been saying that they're looking forward to it, and I hope all of you all are as well. I've heard that many of you are already starting into working with your teams, so I think that's going to be a very good process for us coming forward. I also want to mention that with our Building Inclusive Teams training that we had, the follow-up piece with the Post-it exercise, I'm working with Jared, and Jared is working with the team, the trainers, to put together a workshop as to how we can follow up with that. So we haven't forgotten it. It's just timing and getting everything all scheduled. So I just wanted to bring that up, and I have some other things I'll just bring up this evening. Thank you.
Ms. Jordan?
Okay, the strategic planning, I met with my team, and we are working on creating business and organization partners to mentor our students. So it's a win-win for everybody, and the first ones that we're going to try to get mentors for is Success Academy. So we have our work cut out, but we're going to do it. I'm excited.
Thank you. Ms. Vaughn?
I have nothing.
No. Ms. Morgan?
So I sent out an email to everybody mentioning that I was concerned about the updated policies based on the 18 and 19 legislature. In the past, Keith Martin would tell us after the completion of the legislation what policies needed to be updated, and he would work with staff to bring those policy amendments forward. I don't think that happened with Rob Dodig, and I think it is incumbent upon us to find out, where we may be on policies. That's number one. And number two is that we started in, I believe it was 13, made our way entirely through the policy manual, and we're supposed to be going back and doing it again. And listening to Ms. Giovanelli talk about one of the policies, it makes me think that we need to, as a board, be looking at these policies because new eyes see different things in the policies, and so we need to get into a review process. I'm not saying I know how to to respond to this. I know that historically, a staff member would work with Mr. Martin to help with that policy, but I don't think we have anybody designated now to do that, do we? Okay.
So back to your recommendation a while back about Neola, why can't, what about our budget, right now that we're in the budgeting process, why can't we talk
Because
about that?
we didn't budget for it.
Oh.
That was my understanding when it came up before, that we had not budgeted for it.
But what about for the,
Well, we're already, yeah, it's not in the 1920 budget.
Dr. Atkins?
Well, it is an issue that we are aware of. I've been working with Brian Williams and also the chiefs in the cabinet to address the need to have a legislative person that works with the board and make sure that our policies are up to date. And this is also something that I mentioned to our lobbyist, Carol Green. So we're in the process of doing that. I believe Mr. Williams has he's reached out to someone.
Yes.
Okay.
Yes. He's talked to my office as well.
So we're working on a plan to address this need, because yes, it wasn't addressed as it has been in the past. In addition, we were able to get a brief that was provided by Joy Frank, which you're familiar with, that is provided to superintendents, and also Brian. I believe our legal eagles across the state also get their own brief, so he's been working to get that to us as well, and working with other districts statewide to help make sure that we are in compliance with policies from this upcoming this past legislative session.
Great, thank you. I want to say to Mrs. McCabe, it is delightful to see the light on in the PR room, or whatever you call that room. It's nice to see you behind the glass. Thank you for coming back, and I'm excited to be working with you again. And then I have one question that came up from Ms. Gittens' email to us about her meeting with Commissioner Pendergrass. The second piece of that, you attached a piece of paper that Pendergrass had made notations on. And one of the sections was pool facilities and recreational maintenance, and it gave a dollar amount for the district and a dollar amount for the county. And then he had made a notation of 50%. Was there discussion about changing the way in which expenses for pool and recreational facilities is allocated between the two, or was it?
It was, actually, that list was from Mr. Deschalets.
Yeah.
And we did talk about recreational facilities, not about changing it. To my understanding, it was just a discussion that this is what we have at this point. If it's something that we would like to discuss with them to change, that's kind of what this is all about, is opening up the door to do that.
Well, my concern is that the county is going to look for every possible opportunity to claw back money from us, or not claw it back. I mean, just to say going forward, they're not going to support this stuff. And I was just concerned when I saw that notation that, we were opening the door to a conversation with the county about changing the way in which we allocate expenses between the two entities for certain properties.
Do you want to address that? I didn't get that impression, but.
Specifically with Commissioner Pendergrass, I know that we did talk about a little bit with the Estero athletic facilities, because there was a little bit of concern about our broker, in terms of the property negotiations that were going down in that area, and trying to work out some joint use athletic facilities. They felt, the county I'm speaking of now, felt that at this time they didn't need additional sports facilities relative to that area of the county. And so they just let us, kind of notice us regarding that. The other piece of the conversation, though, I think was just to raise our level awareness that dollars that they have spent, a significant portion of dollars that for hurricane recovery on school district facilities versus municipalities, and then also pointing out in this case where they have spent some of their capital resources on things that benefit the district. So I took it as more of an FYI. I will say that we are working right now with the county relative to our construction projects on a number of different fronts. One of them, I think Mr. Rickenbacker was briefed the board about hardening. That is something that we do feel we need additional discussion. I know that in the past they have footed the bill for 100% of some of those shelter costs. The difference is the requirements of those shelters have changed, and so what they have asked for is just simply some type of agreement in terms of how the school district and the county are going to handle these types of expenditures moving forward. So that is something that I'm working with Dr. Desamores on with our capital committee. So we had an initial discussion last capital committee, and then we're going to meet again this week. Amy and I met yesterday to discuss it further, and I'll keep the board posted on that. And then lastly, and this is something that I will send to you if I haven't already, I'll make sure that I did, but we did yesterday, Madam Chair, we met with Brian Hammond and also Frank Mann.
Yes, I haven't done the update to the board yet. I will be getting that out to them as I did with the other one to give you the follow-up in what we discussed.
So one of the things that we did discuss that I have a little bit more of an update, which I can send you on. We talked about the bus stop safety issue and how we wanted to work with the county like we're working with the city of Cape Coral. So we are doing that. They gave us an update regarding the Lehigh Acres school lighting MSTU, which is an advisory committee that actually has some taxing authority out there. So their goals are to have street lights in close proximity with all school bus stops, light high crash and crime locations, implement a programmatic approach to add lights at all intersections, and implement a programmatic approach to add light to non-intersection location as needed, and then handle other requests. We provided East Zone school bus stop information, and they have identified 419 school bus stops and have indicated that the LCEC, who they have to work with, LCEC and FP&L, to install these lights, but they are anticipating installing 241 lights at our school bus stops by the end of August, so that's some good news. And then we'll reach out to FPML and see if we can get the rest of those unlit areas. So that's an example of another partnership that we're working on now with the county to try to help improve school bus safety. And I just received that from Mr. Winton today. So.
Today?
Yeah.
Because since you brought that up, can I add a little bit?
Can I allow Ms. Morgan to complete her comments, please?
That's it. Those are my comments.
Okay.
Thank you.
Ms. Jordan?
Yeah, the only thing that I would ask, and I did speak to Dr. Atkins yesterday about that, months ago we had spoken about when we having a roundtable discussion with all the commissioners, as we did with our legislators, which would have involved all of us. And I just think going forward, we need to make sure that we are all included in that conversation, because I believe that when you show a unity of all of us being there with all of them, it just is much better than one individual. So I would just appreciate it, consideration for the next time of possibly having a roundtable discussion where we all can be included.
Ms. Gins?
Okay, and in answer to Ms. Jordan's question, this was a discussion that the superintendent and I had, and he was going to set up these meetings, and it was decided that I would go as the board chair. There was no intention at all to not include anyone, which is why we share all the information every time that we meet. If it is something that the board would like to have a roundtable as we have with the state legislators, that's something that we can put down and to attempt to do that as well. Sometimes in building relationships, even for an organization as a whole, we have to start at some point. And starting at that point to build those relationships does not always mean that we would all attend everything. It is like opening the door for, in the future, for us to all meet together. So that's kind of what this process has been. I have heard from several of you at this point of being excluded from this process. It was not an exclusion. It was a initial time to meet with legislators, and that's it, not to exclude anyone at all. So I will make note that if everyone wants to have a local legislative roundtable like we have with the others that was discussed on Thursday, then we can decide to do that.
I have a comment.
Ms. Morgan?
So I think my comment would be this. If you are setting up meetings as board chair to represent the board and not including us, okay, but then we need to know what the agenda is, because after all, we as a board set the agenda for our conversations with the county commission. So I would say, with all due respect, that if you are meeting to represent the board, that you share with the board what the agenda is and give the board an opportunity to weigh into what the agenda will be.
Well, actually,
At this point, I'm going to cut off board comment because we are on item J, which is board member comments, which does not allow for a back and forth, and I believe it's my turn for board member comments. I have no comments this afternoon, other than to say that I'm trying really, really hard to stick to Robert's Rules of Order, which allows for one comment by each board member on each subject, followed by a second comment by each board member on each subject. So if I could beg your participation in following those rules, I would really appreciate it. The next item on the agenda is board attorney comments. Mr. Attorney Gabriel.
Only comment that I would make in the conversation that you're having about having joint meetings, of course, those would be sunshine-required meetings, and they would have to be advertised and published as well, so just to those comments. Thank you.
Thank you. Dr. Atkins, superintendent comments?
All right, I'm going to see if Dr. Desmores could come up and maybe address the property inventory thing. I'm hoping you're here because I asked somebody to get in touch with you. If not, she could. A little
surprised.
Anyway, I think.
For the fun of the meeting, Dr.
Yes.
Atkins.
So Dr. Desmores, there were some questions that came up relative to process and procedures related to our unable to locate. And I know that I had started working with Mr. Blurton and staff prior to you coming back on changing some of those procedures, such as instead of the 2-year unable to locate, moving toward like within 1 year and those type of things. And I was going to have you provide us with a memo later, but if you can do that in person, not to put you on the spot, but since you're here.
Sure, I'm here because I love to be here, mostly because I have to be here, but I'm here for you. Okay, so the question was what our procedure is right now for tracking down inventory items, and what some of the changes to the procedures will be. So right now, the procedure is every location gets an inventory each year. At the time of the inventory, our inventory clerks will go and they have the report of all inventory that is at any particular location, or that is scheduled by our reports to be at any given location. They will look for those items, and at that point, after the inventory is complete, any items that the inventory clerk has not found while they were on site, they will work with the principal and staff at the location assigned to safeguard assets. Most of our locations have at least one person that is assigned to that responsibility. Many times it's the tech support person at the school, or it could be someone else. So we work with that tech support person to locate any items that may not have been found in the initial pass of the building. Once we've done that several times, and there's a lot of back and forth between the property inventory staff at the school to make sure that we've looked everywhere that we can to find any items that may be missing. At that point in time, we create a report of missing items for the principal, and we discuss those with the principal, and the principal has a certain amount of time to respond to those missing items, and we make sure that we talk about in that response what process and procedures are in place in order to safeguard assets. If those procedures weren't followed, how we will tighten them up, or how we will communicate in the future to make sure that procedures are followed. We used to, or what the standing process had been, was that we would give it a period of time before we would write those items off as unable to locate. So we would do one inventory with the school. If they were unable to locate, we would actually go through another cycle to ensure that we didn't find those inventory items somewhere else at another location that had been transferred without the proper paperwork being done, so on and so forth. Then after the second cycle, we would write those items off for anything that had been unable to locate. We are changing our procedure now to say we're going to do basically a 90-day write-off procedure. So we're going to do a cycle of inventory, or do the inventory at a location. If at that point in time, after we work through that whole process and procedure that we just talked about, if the items are still not found after we've worked with staff, principal at the school, then we will go ahead and do the write-off within 90 days of the inventory being complete. What that does in that process is kind of ensure that we're not getting too far out from the date in which the items were not found. We're taking action much sooner within the 90 days and making sure that either we've done everything that we can to locate the item in that period of time, or it gives the principal a much shorter period of time to react and change any procedures that may need to be changed, making sure that we can avoid any situation of an unable to locate item in the future. So that's kind of in the nutshell, what we're talking about in terms of a change of the process. We are documenting that, and I believe at our meeting with all of our leadership on July 30th, we plan on rolling out that new process and procedure for our administration.
And really, one of the reasons behind this is I really discovered, as a school principal, that if you have a sense of urgency around locating these items, you're more apt to be able to locate them. But it requires work, and it requires, persistence, and requires you to get on it and get the job done. And so I really felt that we wanted to, district-wide, to quote a former superintendent here, raise the level of concern of some of our department or building level administrators so that they jump on these things timely, locate an item, if it means, getting into that back closet and clawing around and finding it, because inventory that is no longer used is often stored away and tucked away in little, dark little corners, and we, rather than going through the proper procedure of locating and writing off an item properly, it just goes on the unable to locate, and then the district looks like it's not being, being good supervising its inventory. So we really felt that this change would expedite the process. The other thing is that was mentioned, Dr. Desmours, is if we discover, items that are stolen, those items should be reported immediately. But any time that you discover something maybe hasn't been reported, I know they work with the administrator to make sure that is reported.
Yes, that's right. So remember, there are several reasons why we write off inventory. Unable to locate is the one that I was just really referencing, but they could be stolen, they could be obsolete, traded in, beyond repair. Each of those things has some documentation to go along with them. If an item was stolen, then we require that there's a police report that's behind that stolen item to document the fact that it was stolen. If it's beyond repair, we have some kind of documentation saying what the cost of the repair would be, and then compare that to the net book value of the asset. And if it's more than that, then we'll say, it's beyond repair. So there are several different reasons why an item would be written off. What we want to make sure that we're really keeping a close eye on are those unable to locate, and of course, the stolen. So of course, things happen at all of our locations, so if they're stolen and that's documented, as long as we're safeguarding our entries and our exits and making sure that we have proper procedures in place, we've done everything that we can do to safeguard that. And unable to locate means that we may not have followed a particular process or procedure, including an item may have been disposed of and the proper paperwork not being done before it was disposed of. So we want to, make sure that we're tightening up on that and making sure that we have process and procedure in place that all locations follow. Now, I do want to say that pretty much overall, I think our locations do a very, very good job of all the, people that are in locations every day and all of the activity that happens at schools of safeguarding our assets. We have over 25,000 assets, I believe, tangible personal property type items that we inventory. On our inventory, over 25,000, and we wrote off less than 100 in the fiscal year as unable to locate. So it's less than half of 1%. So I think for the most part, we have our locations that are very diligent and very vigilant about safeguarding the assets of the district that are purchased with taxpayer funds. And we just want to make sure that we're always on top of revising our procedures so we continue to have a good track record.
Dr. Atkins?
That's really it for my comments. Thank you, Dr. Desamores, for me allowing you, or me being able to put you on the spot and responding to that question. Appreciate it.
Anytime, thank you.
Okay, next item on the agenda is good of the order. Does anybody, I have good of the order carryover from last meeting. Anybody else have an item for good of the order? Okay, so the good of the order item I have is the necessity for us to decide at tonight's meeting who will be the board liaison to the FSBA Legislative Committee. I'd like to go around the table and get comments from each of you. If we could keep our comments to 2 minutes, I'd appreciate that. Ms. Fisher?
I want to reserve my comment. I don't have a comment right now.
Ms. Giovanelli?
Well, actually, so I wasn't able to really participate last Thursday. I'm interested in it as well because I actually, on the public policy with the Board of Realtors, and I go to a lot of luncheons that is not even anything that has, that it was absorbed by the Board of Realtors, the public policy. Like, I'm going to the Tiger Bay luncheon. Today I was at the Chamber luncheon. So I have the ability to do that, which is no cost to the district, and it's something that I like doing, and I would love to continue to do that in the support of our team.
Ms. Gittens?
I still have the question, are we discussing the FSBA liaison, and have we tabled the other proposal that you brought up last?
I will get to that next. Right now, we are just discussing the FSBA Legislative Committee liaison.
Okay, and as I mentioned at the last meeting, I was interested in doing that.
Ms. Jordan?
I as well would be interested in doing that. I have experience in doing that with the Florida Restaurant and Lodging Association, with Country Clubs of America's, being their liaison for many years. And I also attend many lunches, which would be at no cost to the district.
Ms. Vaughn?
I'm not interested in doing it, but I am looking forward to having a vote during our action meeting, since we have so far 3 choices.
I have no interest.
Well, I'm looking to find consensus. My preference, as I mentioned last time, would be Ms. Jordan, not just because everybody loves Ms. Jordan, but everybody knows Ms. Jordan too. I'm stunned when I'm down in the south part of the county. How much time do you spend down there? Not a lot. And people know her. So that would be my reason for supporting Ms. Jordan. I'll go through, because I'd like to make the motion tonight, but I don't want to go through 3 different people. So I'll go through and see if we can find consensus on one, and I'll make the motion accordingly tonight. Attorney Gabriel, is that
It would have to be tonight.
right?
At the regular
Okay,
board meeting.
so do we have consensus on Ms. Giovanelli? Thumbs up, thumbs down?
I'm sorry, I didn't realize that you were doing this to get to a consensus vote. I thought we would have some discussion on it.
Yeah,
Okay, well, let's go back around again. Ms. Fisher, do you have any comments?
I think that it's important for us to do this forthwith, and I think that people have to have an interest. It is an amazing experience. FSBA provides us with a multitude of legislative updates, and it's good to be part of that decision-making. So, and I appreciate that we have 3 people who are interested. And this is for 2 years, right?
Correct.
Okay. So then you're asking me to give you my vote right now?
Well, no, I mean, I'll seek consensus when we're done with our second round of comments.
Okay, that's all I
Ms.
have right now.
Giovanelli?
No, I made my statement, so, I mean, I attend many functions, so, that all our legislators are at most of the time, so there's not many functions that I don't go to that they're not there.
Ms. Gibbons?
In my, 6 months that we have been on the board, that I've been on the board, I have visited with the legislators locally and in the state twice, once with FSBA and once on my own. I feel that it would be a good position for me if you are lobbying for something that has to do with the schools and education. I have been a teacher, classroom teacher, and been in the district and involved with all the things that we are lobbying for. I have also come up with suggestions for legislation, and especially the 2 this time, I would like to be able to kind of see that to fruition as well. So that's why, and also I was alternate this year, but really didn't get an opportunity to participate in any way, so.
Ms. Jordan?
Okay, I have already stated some of my reasons, as well as not ever being in the education system, but being in it because of the fact that I have children and grandchildren. So I'm very aware of what has taken place and what is needed to make sure that we provide a great education system for those children going forward. Also, as an alternate, I've had the opportunity to sit, to be on the phone and be a part of the discussion when you were not able to be there. So I'm still asking for that, your vote, everybody's vote.
Ms. Vaughn?
I think this, especially when we're running so far over this meeting, I think it's redundant to be doing a consensus vote. I would like to do a vote tonight when we have time for discussion, and that's my feeling.
Ms. Morgan?
Toward it.
So liaison to FSBA Legislative Committee, not the FSBA Legislative Liaison, needs to be somebody who is a very disciplined worker when it comes to legislative material. I think a lot of it is difficult to parse. I think that, what else do I want to say? I just think it's got to be somebody who has a great working relationship with everyone, has a good reputation working with people, has a reputation for knowing the material and being articulate about the material. So I guess those are my comments.
And I will just follow up by saying, I'm not sure that there's clarity on what the role is. There are monthly go-to meetings, telephone meetings, that the board liaison is asked to attend, and as session gets underway, those become biweekly or weekly. You represent the school board in determining what the FSBA legislative platform will be, and you're part of those discussions. This is not advocacy. There is a separate advocacy committee for the FSBA, and anyone is welcome to join that committee, at least this year, until the policy changes at the FSBA level. So it is, I would agree with Ms. Morgan, someone who can parse the materials that are sent out by Ruth, have a good understanding of them, and participate in those weekly conversations. I had completely forgotten that you filled in as my backup in the times that I was unable to. So, all of that being said, we've each had 2 opportunities to speak, so I'll start from my right and go to my left in terms of the people who've expressed interest and asked for consensus in advance of tonight's vote. Do we have a thumbs up or a thumbs down for Ms. Giovanelli? Is that thumbs up, down, or you can live with? 2, 2, 3, 4. You can live with, I need a yes or a no. Thumbs up or a thumbs down? Okay. Next would be Ms. Gittens. Do we have thumbs up or thumbs down for Ms. Gittens? Four thumbs down for Ms. Gittens. And Ms. Jordan, thumbs down or thumbs up? 4 thumbs up for Ms. Jordan. I will make the motion tonight that Ms. Jordan be the legislative liaison to Florida School Boards Association Legislative Committee. Next, and we don't have really any time to discuss this at all, so we did sort of table the item for a board legislative liaison, a more comprehensive role for a board legislative liaison. Attorney Gabriel, I know you had some conversations with Attorney Saunders today regarding this and whether it needs to be policy or protocol. I left our last meeting sort of confused as to why it had to be policy and it couldn't be protocol, since all other liaison positions are part of our protocol as opposed to part of our policy. Mr. Saunders indicated that it would be helpful for us to have a general procedure with regard to the appointment of liaisons in the event more than one person is interested in doing it. So what is your recommendation?
Well, to the very question about the position that you're talking about, it hasn't been defined yet.
Correct.
So until you define the position, it's hard to determine as to what would constitute the appropriate means in which to address the process, and making sure that there's whether a rule is mandatory, required, or whether you could do it through some other means by protocol. By the original discussion, information that I saw that was put out as to what was intended, it's my belief that it should be by rule, because there's so many parts to this, and so much authority that seems to be addressed, and also budgetary issues that are part of that, it needs to be identified and specifically approved by the board as a whole.
Okay, I think the one thing that we all seemed to express at the last meeting was that this is a time-sensitive issue. So, Dr. Atkins, when's the next time we as a board can discuss this?
I'll check on the 15th, possibly the 15th.
Okay, if any board members who are not going to be present could get comprehensive comments to the board attorney in advance of July 15th, that way your input will be taken into consideration in any discussion we have. Is that fair?
But our vote will not, correct?
Correct. There will not be a vote. This will be just a discussion. Right? Dr. Atkins, a briefing or a workshop item?
Briefing or workshop, yes, ma'am.
Because if we do go in the direction of policy, that would require significant time. Yes. Can we reach consensus that either thumbs up on that plan, or can live with it, or thumbs down? Yeah. Thumbs up? Excellent. Okay, seeing no other business, this meeting is adjourned.